By definition, continuous murmurs are murmurs which start in systole and continue uninterruptedly through the second heart sound into diastole. It is not necessary that a continuous murmur by definition is heard throughout systole and diastole, though the typical continuous murmur of PDA or patent ductus arteriosus is heard continuously throughout systole and diastole. But definition does not mandate that it should be heard throughout, only mandates that it should be starting in systole, continuing through second heart sound into at least part of the diastole. So this is the diagrammatic representation of basic definition of a continuous murmur. There could be a gap after first heart sound and before second heart sound. It starts in systole, continues through the second heart sound into diastole. So it need not be the whole of the cardiac cycle. That is, continuous murmur is not necessarily really continuous throughout the cardiac cycle, though as we know PDA murmur is continuous throughout the cardiac cycle because the pressure gradient between aorta and pulmonary artery are there in both systole and diastole. Just among continuous murmurs is one that is due to rupture of sinus of Valsalva into the right ventricular outflow tract. But the peculiarity of this murmur is that it has a diastolic augmentation. It is because in systole, the RSOV tract into the RVOT gets compressed due to right ventricular systole and the flow in systole is less. Hence, there is diastolic augmentation of murmur of rupture of sinus of Valsalva into the right ventricular outflow tract. It is a very superficial murmur because RV outflow tract is quite anterior and near to the chest wall. This is diagrammatic representation of continuous murmur in PDA. It peaks around second heart sound as the gradient is maximum at that time. Yet the murmur is heard throughout the cardiac cycle, both the whole of systole and diastole. It's usually a loud murmur with additional sounds known as eddy sounds, multiple clicks heard throughout the cardiac cycle due to the turbulent flow, and that gives it the name train in tunnel murmur because of the loud continuous murmur and eddy sounds which occur in patent ductus arteriosus. It peaks around second heart sound. There are other continuous murmurs like venous hum, mammary souffle and murmur of arteriovenous fistulae which are also continuous. Venous hums are low-pitched continuous murmurs due to flow of blood in the great veins. They are best heard with the bell of the stethoscope. Cervical venous hum can be completely obliterated by pressure over the major neck veins. It also changes with position and is better heard in the sitting position than in the supine position due to the effect of gravity. Looking down or the side may also make cervical venous hum inaudible. These maneuvers are helpful in differentiating it from continuous murmur of patent ductus arteriosus.